Assalamu alaikum everyone. First of all, thank you so much to the Department of Physiology, Government College of University, Faisalabad, and Second International Brain and Medicine Conference 2024 for giving me an opportunity to represent my research project via online mode of the presentations. So, my name is Rohaib Qadir and I am an alumnus of Department of Biosciences, Zabis University, Karachi campus. The topic of my research project is the neuroprotective effects of Lepidium sativum seed extracts against diabetes-associated dementia in albino rats. So in today's slide, I will be covering these topics: introduction, aim of the study, material and the methods, results, conclusion, and acknowledgements. So let's begin with the introduction. The slide represents the keywords of my research project, that is albino rat, streptozotocin, dementia, diabetes, Lepidium sativum seed extract. Diabetes mellitus is a severe metabolic disorder, causes numerous complications, including nephropathy, retinopathy, and neuropathy, etc. The hyperglycemia condition causes the severe excessive formation and insufficient removal of highly reactive molecules such as reactive oxidative species, and there is the formation of anti-glycation end products. Hyperinsulinemia causes the insulin resistance, reduce the insulin receptor expression, and which leads to the accumulation of beta amyloid proteins. These affect the central nervous system directly and particularly to the region of hippocampus, which is associated with the cognitive function. This results in the development of neurodegenerative condition, which is a progressive and irreversible loss of neuron, which is also known as dementia. Since diabetes mellitus causes the hyperglycemia, in that response, there is a production of anti-glycation end products and production and insufficient removal of the reactive oxidative species. On the other hand, there is an impaired insulin signaling and um, reduction in the expression of insulin receptor. On the other hand, there is the phosphorylation of tau protein. Phosphorylation of tau protein reduces the acetylcholine content. In that response, there is a reduced acetylcholine esterase activity. Lepidium sativum. Lepidium sativum seeds belongs to the family of Brassica. Garden proceeds has an antioxidant activity, a proven anti-diabetic, analgesic potential, and antihypertensive activity. These seeds are rich with the phenolic compounds and which gives them an antioxidant property. Other than that, the seeds are rich with the memory boosters such as linoleic acid, arachidonic acid, and cholinesterase. The donepezil is an anti-dementia drug. It works by inhibiting the acetylcholine hydrolysis by binding reversibly to the acetylcholine esterase enzyme. The aim of the study is to investigate the neuroprotective tendency of the Lepidium sativum seed extract in comparison to the commercially available anti-dementia drug against diabetes-associated dementia. Material and the methods. 36 albino rats were chosen for this study. Initially, these rats were divided into two groups. The first was the diabetic and the second one non-diabetic. The diabetic group was made diabetic by administration of streptozotocin. On the other hand, the non-diabetic group was remained the healthy. This normal saline was administered in the place of streptozotocin. And further, once the model was developed, the diabetic group was further divided into four groups. The first one, the diabetic control or the disease group, received normal saline as a treatment. The second one was the diabetic. The second group received donepezil as a treatment. The third group received 100 mg per ml of the garden cress seed extract as a treatment. The fourth group received the 200 mg per ml of garden cress seed as a treatment. Similarly, on the other side, the non-diabetic group was divided into three groups. The first one was considered as a healthy control. It received only normal saline as a treatment. Other than that, the two groups received 100 mg per ml and 200 mg per ml of seed extract respectively. Experimental design. The model was developed by administration of streptozotocin drug 60 mg per kg intraperitoneally and 5% of sucrose solution was given orally. After 3 weeks, the diabetes was confirmed by estimation of blood glucose level via glucometer, and the dementia was confirmed by some of the memory parameters, such as the novel object recognition test for the recognition memory, passive avoidance test for the associative memory, and the Morris Watermaid test for the spatial memory. For the period of 4 weeks, the rats were treated with the methanolic extract and donepezil. The dosage of the donepezil was 1 mg per kg, whereas the concentration of seed extract was 100 and 200 mg per ml. At the ninth week, the rat were decapitated and their brain sample was collected. From the brain sample, acetylcholine and acetylcholine esterase activity was measured by spectrophotometrically, and the blood glucose level was monitored uh, throughout the experiment at the end of every week. Results. The results were statistically expressed as a mean, median, plus minus, as a mean, plus minus standard deviation, and one way ANOVA was applied. Here is the results of blood glucose level. It can be seen the line that is marked as a orange. It is a disease control since it does not receive any of the treatment. Other than that, the line that is marked with the blue, represent the uh, it represents the diabetic group that received the donepezil group, since we know that donepezil does not have any of the role in the management of the diabetes. Other than that, the line that is over here that represent the diabetic group that received the 200 mg per ml of the seed extract. After the administration of streptozotocin between the period of the 5th and the 9th week, it has been seen that the blood glucose level has been drastically decreased, and it came to a normal position or the normal level, which shows that the 200 mg per ml of seed extract provide us a better results in the management of the diabetes or the blood glucose level. Other than that, pre and post treatment behavioral analysis, as initially the rats were divided into two groups. And the first one was diabetic and the second one was non-diabetic. The pre-treatment behavioral analysis results suggested that there are the memory deficits in the diabetic group, and the steric represent a significant difference against the healthy control. 0.0 at the p at the value of p 0.05 and 0.01 respectively. On the other hand, these are the post-treatment behavior analysis. The first one is for the novel object recognition test. These here are the hysterics represent the significant difference. The results suggested that the group that received 200 mg of seed extract and 100 mg of the seed extract spend more time in the exploration of the new object exhibits the memory improvement. Whereas the group that received the donepezil, it shows the least significant difference against the diabetic control, and having the least effects in the memory improvement. The passive avoidance test. So static represent different significant value against different groups at a different values. The results suggested that a group that received 200 mg per ml of seed extract uh, uh, that received the 200 mg of the seed extract was compared against the healthy control, and it shows the better results. Whereas the group that received the 100 mg per ml of seed extract and 200 mg per ml of the seed extract has to be observed spend more latency time, and which indicates the memory improvement. On the other hand, the group that received the donepezil have shows the reduced significance against the disease control as compared to the other two groups that received the 100 mg per ml and 200 mg per ml of the seed extract. These indicate that uh, they, uh, they respond well. Other than that, the Morris water maze test. The Morris water maze test shows that the group that received the 200 mg per ml of the seed extract and donepezil uh, drug, uh, donepezil drug that shows much more positive result comparatively to the 100 mg per ml of seed extract. Neurochemical analysis of the brain. For the neurochemical parameters, we choose the acetylcholine content. The acetylcholine content was measured through spectrophotometrically. These are the significant values against significant values. Uh, so the group 100 mg per ml and 200 mg per ml of seed extract was shows the promising result comparatively. The group which received the donepezil, it shows the memory improvement. Now, the second neurochemical parameter is the acetylcholine estrus activity. So here are the significant values. It shows that the group which received the 200 mg of 200 mg per ml of the seed extract gives us much more positive results, and it indicates there is a memory improvement and there is an increased release of neurotransmitter, that is the acetylcholine estrus. Oh, sorry, acetylcholine, in comparison to that of disease control, whereas the donepezil, the group that received the donepezil, it shows the least enzyme activity, which could be concluded that it release least amount of neurotransmitter acetylcholine. Conclusion. There are the three conclusions that could be obtained from the study. The first one is the seed extract provide effective results as compared to the donepezil. Yes, it does. The second one is it could be recommended for the treatment of dementia and diabetes simultaneously, and it has been observed that for the diabetes associated dementia, only those drugs could be recommended or could give us a positive results which work together which work simultaneously for the diabetes and dementia as well. In future, it could be use an herbal medicine with no side effects against dementia. And it could provide a long-term effects against dementia. Acknowledgement. First of all, I would like to acknowledge Dr. Saita Tabassum for supervising this project. The second one is the Dr. Irfan from the Federal Urdu Arts and Science University, Science and Technology University, where the project was executed. And then Zabis and the Auric Department of Zabis for providing us the seeding money for this project. And then my two group members, Mohammad Saad Arshad and Anza Sana, and now last but not the least, GC University Faisalabad and IBCC. Thank you so much.